Preventative actions have been put into effect to create a safe place here on campus, with wearing masks being one of the most important.
Really, since the summer, we've worked hard to create atmospheres in the classroom, in the laboratory, in the residential life settings, in the commons areas that would be safe. And we've worked hard to institute public health best practices that would reduce the risk of spread. Namely the physical distancing at least 6 feet from others, the guidance for strict hand washing and frequent hand washing, and also for masking.
Since the beginning of fall semester, there have been a fluctuation in the number of COVID-19 cases diagnosed, recovered, and active. But what specifically happens to students that contract COVID-19? Affected students and Dr. Edwards say hotels, dorm rooms, and other opportunities to go home are all options for those who become ill.
Student housing contacted me and I let the school know that I tested positive. It's like a self-report online with the dean of students. And they called me and they said like, hey, we have a hotel you can stay in. We'll provide you food through your meal plan. If you don't want to do that, like you're more than welcome to go home. We just know that that might not be the best option for a lot of people just because of how far away some people might live. Then when I got to the hotel, there was a baggie and it had a thermometer, hand sanitizer, like tissue paper, like a couple other things just to help, and face masks. And then they actually contacted me the next morning asking me if I had any food allergies, all that kind of stuff. And then they sent me over a box of food.
Sophomore Adrian Clasian says with hotels being a limited option for the university, some students were instructed to stay in their dorm rooms. He also says food, drinks, and consistent checkups were provided by tech to help get through this tough time.
Well, I had to stay in my room for 10 days, quarantine, and the 10 days went by, I'm back in class, I'm feeling completely fine now. The health services on campus, they would reach out to me every 2 days after I tested positive just to ask how I was feeling.
Between free testing and encouraging mask wearing inside and outside of the buildings, providing for those who have contracted COVID-19 and more, Dr. Edwards is hoping that these efforts will encourage students to take precaution and create a safe space.